Okay, yes. Okay. Are you seeing?
Yes,
Hope
ma'am. Yes,
everyone.
we can see it.
Yes, ma'am.
Uh, yes. Hope everyone is seeing, and good evening to one and all. Deepa,
Yes, ma'am.
thank you. And you have to tell me if there is any problem, because I have kept in the smaller one laptop, so that I have kept it only presentation part. Okay. I may not be able to check what the
No worries, ma'am. Then thank you so much. I just thank you from bottom of my heart that
no,
taking out your time from your busy schedule, as well
no.
as right now I can understand there are times when technical glitch happens.
Yes. So the
You are so well versed that you have joined from another system and everything for the students as well as for us. We are
yes,
really thankful.
thank you, thank you.
I just request you if we can begin this session now, and
Hope
whenever anything happen, I will.
hope all of you have answered for the question paper. Yes, Deepak, you have
Question
done it.
paper would be given
You have given it to them.
in the end.
At the end, you want to give.
In the end,
Okay, okay.
yeah.
Because the answers may not be there in the present session, and the questions are there from the whole subject of it, the various questions, and some one or two may be there in this one. And good evening to one and all, my dear students, and whoever has joined this one. And I am thankful to Thema Publishers, and especially the Deepa Tandon, who was after me to do it. I'm thankful to her. And this is going to be a session for 3 days. And 3 classes means will be boring for all of you. But let us see how to make it interesting. And we have already seen what is the problem with the technology. And we have shifted from chalk and talk to PPT and to this. We have evolved. The teachers have evolved because based on the need of the students, as per their needs and their likes, whims and fancies, whatever we call it, we have to change. Change is required from both sides. And regarding the 3 sessions, today's session is started with the exam, how to master the art of writing accurate, impressive, and comprehensive answers in the anatomy examination. That was the theme for today. And if you look at this one, before going to a class, I will make a little bit of notes and what I am going to talk for that. And today, if you observe, I have put the date and what I wanted to speak also, because it may not be visible to you with clarity. I have made it what I have written. And whatever you do, always keep the end in mind. So for anything, the end of my session, I should be able to make you comfortable for writing the anatomy examination with confidence and clarity. And before the exam, what is required? Don't think on the day of examination you can master it, and you have to do some preparation before the exam. You can see that triple R, RRR movie, all of you know, but that movie RRR, we will take it to our regularity and reading and rehearsals. These are important. And during the examination also, you have to focus on 3 C's. And you should be calm, composed, comfortable, and confident. Then only you will be able to do your job perfectly. And another thing is, after the exam also, there are AAA rating is required for you. That is analysis, where you are not able to focus and what are the alterations for the future, and acceptance of your drawbacks and how to improve it all. Then you can focus. Once you realize, you may feel, so now we are approaching the exam. Don't feel, better be late than never. Then coming to the next one, next slide. So what are the objectives for this session is, what are the strategies one has to think of for answering the question paper, and you should require a planning also, planning of time and planning of management of anxiety, and how to structure a long answer and a short answer question, because based on the type of paper you are having these questions, there will be long answers, short answers, brief answers, and how to highlight the key points to maximize marks, and how to avoid the common mistakes which you will be doing, and why you think that this art is required for a doctor, because medicine is the art of inquiring, understanding, and analyzing the problem of the patient. Because ultimately, the end in mind is you have to comfort the patient, and you should understand the problem of the patient, and you should be able to do the appropriate physical examination, appropriate biochemical tests or radiological tests. So that should correlate with the problem. You should be able to find out. And once you find out the problem, you have to plan for the treatment. And the same thing you have to explain to the patient also. That is, for that you require the knowledge. Then what is important for learning? All of you may be telling books are required, YouTube is required, podcasts are required. So above all, what is required is the motivation to learn. Hope all of you have got that one, and that's why you have joined here to learn how to get motivated for learning and for answering properly in the examination. Look at the animal. What is it? It's a mole. What is its job? It will go on digging down, down, down into the mud, and ultimately it will have a hands of mound, and it may find something or may not find anything. And doctors are without anatomy will be like moles. They have to work in the dark, and they may not get anything proper out of it. What are the criteria for acquisition of these skills? I call it as the CIA. And what is that CIA here is, it should be comprehensive and impressive and accuracy. So it should be complete. Answer should be there, including all components of it. For example, for a question, you should have a gross anatomy, developmental anatomy, histology, clinical application. All these aspects, you have to think of it, including a diagram also. And what is the what is it that makes it impressive? Once your answer is seen, the teacher should say, or your own colleagues should say, wow, what a great answer. Very impressive, the way presented or she has presented. It looks grand. That should be there, and you should have that skill of presentation and your handwriting, and how to overcome if there is defects in the handwriting also. We have to plan, and tables, flowcharts, figures, what are all the things that you have to take care of, and how accurate it should be. That also is important. And you have written so many exams before joining the MBBS course. And you may be thinking, how is that exam different from what you are going to write in your MBBS course? And how is it different? Is it the difference between content? Yes, content is vast here when compared to what you were studying in the previous days of your life. And the teaching pattern also, it is different. There is no spoon feeding here. And because it's such a vast subject, you should try to find various ways and means that will suit to your learning pattern. It will differ from person to person and at different times and for different topics. And lifestyle changes also are there, and what is the priority you are giving to the studies? That's also important. And so put a focus on that. And in the lifestyle, what you think is, if I burn out the night before the exam, I will get through. And you may be spending hours of lot of hours, but what is the quality of output from that? That is more important than how many hours you spend. Then, so you are in a transition phase. So it is a continuous in all walks of life. So you should have a plan for it. And if you look at this picture, you know that it is from the embryology, what is happening in preconception, and then later on during the 9 months period in the womb, and immediately after birth. So we are also come from the transition, right from the conception to our present stage. And what you will be studying in the embryology is up to the 3 months of age, 3 weeks, one type of development. Then later on, what is the progress up to the 3rd month, and later on what is happening. And you can see how the embryo will progress in this picture. And what is the component which we are important is, you must have seen a flow chart showing the various phases in the human life and what are the stages and the fertilization also. And if you come to this last part, this is an important question. What are the effects or results of fertilization? And if you understand the class, then you have to focus on these points, 6 points. So ultimately, you should understand what is the basis for these 6 points. So transition is a continuous process in all walks of life. Today, you may be student. Tomorrow, you are going to be a specialist. Then what are the strategies for answering a question? Okay, if you see it, this one. So first, we have to reduce our anxiety and we have to plan and how to manage. So first read the question, and I have kept a question paper for you with highlighting certain things. Okay, so what are the keywords? Keywords all should be noted by you with a pen. You note down and what is asked and what is the distribution of marks. If you see where more weightage is given in this question, on that you have to focus. And what was the question asked? So don't get confused. Here I have shown you the pituitary gland. Sometimes you will mistake that because you are expecting some parotid gland, you will think that it is a gland. Just jump to the conclusion that it is a parotid gland and you will start. And another thing also, you have seen pituitary gland, hypophysis cerebrae, they may give, then you get a doubt, what is this? Alternate name is given. And epiphysis cerebrae. So sometimes you confuse epiphysis cerebrae and hypophysis cerebrae. Those things you have to focus. And what was the organ asked? So now once you know these things, you have to sketch outline on how to go about and how to start the introduction and main points. Take a question. There is a case scenario based question is there. And first, you should question yourself and you have to be in the other shoe. That's what from the patient point of view we say. And then the question is asked also. Why I have used the word shoe also you will know. Because the problem is a medical student. Okay. I was walking on a hilly terrain and he noticed that there is a tendency for his feet to go into partial eversion more often than into inversion. So hope all of you have started the movement of what is eversion and inversion with your feet when you are listening to me. And he felt that medial margin of feet is being strongly placed. More pressure is put on that. Then the question is he correct in his observation? If so, what is the abnormality? Start thinking, okay, whether it is abnormal or not. What is the reason for this tendency? And which muscles produce such a tendency? And what is the functional significance? And what anatomical knowledge is required for explaining? These are the thoughts, questions were asked. So now we have already put the bullets. So first, we have to put the bullet when you are answering also. Then you can expand later. And you have to leave some space for expansion. So if you want to add some points, there should be some space. And always draw the diagram first because it will help you in answering and it saves the time also. And mark scoring also will improve. But that question, if you see the student correct or wrong, correct in his observation, and there is no abnormality. So he is a very inquisitive person and he wanted to probe what is the reason for this tendency. So when you are walking on an uneven surfaces, so there will be a tendency for the natural tendency for the medial margin of foot to get fixed to the ground. So it's a protective mechanism. It's a natural one. And what are the muscles responsible? So they are the peroneal muscles that prevent the excess inversion of foot. So this position is more prone for injury. So what anatomical knowledge is required now? It is inversion and eversion, and what are the joints, and what are the muscles, and what is the nerve supply. These are the things that should come to your mind. Then if you see here, how it can be presented, inversion and eversion movements. Now, hope all of you have got orientation of your inversion and eversion movements of your feet. And I have put a picture also so that you can appreciate that position one. And then what are the things you have to think of? If you see here, what was that? You have to define what is the inversion and what is eversion, what are the associated movement with that, and what are the muscles producing, you can see them, and what is their nerve supply, and what is the movement when the foot is on the ground and off the ground also, you have to think of it, and what are the joints where it takes place. And if you look at it, all these things, if you have a planning, you can present it like this, and it will have a impressive and accurate and comprehensive and high scoring one is there. Then if the question is reversed also, you have to think. So they started with the movement and the muscles. Then if the question is twisted like this, enumerate the nerves that supply the muscles producing inversion and eversion of foot, and give their origin, root value, course and termination, add a note on applied anatomy. For that type also you should be prepared. Don't think it should come straight away like that, and with a twist also it will come. So then if you start questioning yourself differently, then you will get it. Because we are all familiar when we were young, mathematical tables we were practicing both in forward and reverse direction. So that can apply at any place. Then if you see, what do the examiners look for your answer? And clarity, logical structure and flow, and detail, precise, relevant information is there or not, illustrations, well-labeled diagrams, key points highlighted or not. And an index finger is being pointed for showing these points, and pointed index finger abnormality is there, and think of it. What nerve is responsible, and if there is defect in that, and how it is produced. That's why I have shown this animation, and you guess what is that nerve. Hope you are writing what that nerve is. Now, then when a histology question also, so they may ask any of the cartilages with a neat and labeled diagram, and what you will see in the practical is a plain slide, and you should be able to identify what is the first one, what is the second one, and what is the third one. Then that is the practical part, and they ask you to draw a diagram and label it. So what is this cartilage? What is this one? What is this one? So how to label it properly? Then write the points. So what type of cartilage and what are the example, what age-related changes it will show, and how to remember the examples. For example, for an elastic cartilage, all the examples, they start with the letter E. That's how you can remember. So then the white fibrocartilage, mostly in relation with the joints. What are those joints? What type of what are secondary cartilaginous joints you should recollect, and that you have to mention. So this is the one. And the same question, if they ask, compare different types of cartilage. So based on histological appearance and extracellular matrix, because it is a comparison, you should have a comparison table. And what are the various components, histological components? If you see cells, matrix, perichondrium, ground substance, function, example, all inclusive, you should plan a table like this. Hope it is clear to all of you how a table can be prepared, and what are all this type of questions are possible if a lymphoid tissue. So how to compare the different types of lymphoid tissue you should plan. For the blood vessels you should plan. For the muscular tissue you can plan. So these are all the things that should be handy for you when you are doing that. Similarly for the muscle histology, the 3 different types you can plan. And when is your real examination for the doctor is when you are the examinee and the patient is the examiner, and they will be going on putting so many, where is the problem, what is the cause, why and how it has occurred, what investigations are you going to recommend, and what is the basis or logic behind each. Then what treatment or management, what is the success rate? So many questions they will ask. So you should be able to answer. So for which you should be properly equipped. Then this is the torticollis, a short notes question for 3 marks if they ask. So this is how one student has presented. And when we do corrections, we will add like this. What are all the missing ones we will put? Then how it will be turned. It's a good presentation when compared. And this is the other one, torticollis types he has mentioned. Not mentioned the word types, and what is the reason and cause he has not mentioned. So when we correct all these things and put it, it will be like this. So this is how, what are the subheadings, side headings you have to plan, and what is the cause description, and what the different types, and what is the cause for it. So this will look a precise one, and it will be more impressive. And using different color codes is also important when you are answering. And the journey so far here, what we have discussed is read the question, think, plan, write, I said, and what are the mistakes you will commit, and bullets first, expand next, I told you, and prioritize high scoring questions. How to prioritize, that is another one. And before that, see, there will be questions that requires critical thinking, analysis, and application. And there is a student who, this has, I have prepared the case which has happened actually. So a student at the age of 22 years driving from the home without informing the parents, taking his friends for a birthday, for his own birthday party, and car hit the ambulance, and he could not control, and some of his friends, they have expired, and this student was taken to casualty. And clinical findings I am going to present. And what is the anatomical basis for this? One has to explain. Okay, so there is fracture, dislocation of 7 cervical vertebra. There are signs and symptoms of severe damage of spinal cord. There are left-sided symptoms of paralysis of left leg, and a band of cutaneous hyperesthesia around abdominal wall on left side at the level of umbilicus, and a narrow band of anesthesia, loss of touch sensation and loss of pain sensation below the level of umbilicus on left side. The right side, there is total loss of pain and temperature, and partial loss of touch sensation is there of the skin of abdomen below the umbilicus and involving the whole right leg. See, so many are there observations and how to interpret. So once if a doctor is having the anatomical knowledge, how he will interpret is there is a fracture, dislocation of C7 vertebra is there, and then it indicates damage to what spinal segment they will be able to tell. And when they can tell that one, so what will be the components you will find in the spinal segment, and what are the ascending and descending tracks, all those things one should have it, a thorough knowledge of it, and why there is unequivocal motor and sensory loss on the two sides is, this is due to left hemisection of spinal cord, and because of that there are left-sided signs and symptoms are there, some of them, and there are some on the right-sided signs and symptoms are there because of the involvement of the tracks, and because of the involvement of root entry zone of T10 segment, the left-sided segments, and this can, one can arrive with the knowledge of spinal cord and relationship between the spinal cord and vertebral column, and what is spinal segment, why the spinal segments are important, and corresponding vertebral spines are important. You should have a thorough knowledge of it. And what are the entry and exit of rootlets in the relation with the spinal cord, and what is the arrangement of various pathways, how the fibers are arranged in these pathways from medial to lateral, and where they decussate at the same segment level or after ascending some segments. These are the things you should have a thorough knowledge of it. And another thing you are very familiar with is the flexor retinaculum at the ankle, both for theory and practical exercise. This is required. And what are the boundaries of this? You have to mention. So anterior, posterior, above, below, and what are the structures also? Plan a table like this and look at this one, and what is you observe is what is anterior, what is posterior. These directions are important for you. Without that, you will not be able to write properly, and with that orientation only you have to present, whether you are seeing in the hand or wherever. And if you see here, so what are the structures? If you see here, they are presented from the anterior to posterior. Okay, so then if you see here, yes, you are right, Brown-Sequard syndrome, somebody was writing. Okay, good. Then the anterior to posterior, and how to remember and how to draw the diagram. See the diagram of it. One of the students only I am focusing, and how to remember. So there can be some mnemonics also, which you are all very familiar for so many. And just for example only, talented doctors are never hungry. So with that mnemonic, you can check also, but better to remember by seeing at them and orienting repeatedly rather than the mnemonic. Otherwise, you will be lost with the mnemonic. Okay, that is the thing. And see the presentation which I did previously of one in this one, and how they have written in this one. So this looks clumsy, and try to make it a properly structured one. And you have to add a note on the clinical application also, tarsal tunnel syndrome, and you have to give explanation for that. And when you are writing the flexor retinaculum in relation with the lower limb, think of flexor retinaculum in the upper limb also, so that you can revise both of them also. That's one way of revision for you. Then there is the how to manage the anxiety part. Okay, so time management is also another one that causes anxiety to you, and we have to follow a rule, prioritizing high scoring questions, and avoid getting stuck with one, because you know one very well, you don't spend more time on that, leaving several of them. That's what happens most of the time with the students. And balanced pace you have to maintain, not writing very fast, very slow. They will write in the initial step, and later on only ECG, EEG graphs we will see, and no meaningful sentence or word. So it becomes a clutter, illegible ones will be there. And looking at the clock in between also, at least make a point to look at the clock after every 5 questions. So that's also important. And not wasting time. So you think that spending time in reading the question paper once or twice is a waste of time. So that's not wrong, and you should be able to spend some 5 to 5 minutes in reading it, and then for planning it and for reviewing also at the end you have to give some time. That is the one. And then there is a how to prioritize the high scoring questions. If you see the type of questions, long essays, and how many marks totally, it is only 10 marks. If you take the short essays, there are about 11 questions, and each getting 5 marks. And how to distribute the time is 5 marks questions. You have to spend 110 minutes on that. So how much? According to marks, you give the priority for each, and for brief answers, spend 15 marks only, but spend some 10 minutes. And for reading the question paper, you should spend 5 minutes. Focus on it and highlight the points or underline what are all the things on which you have to focus, what organ is asked, what are the subcomponents in it, and what is the highest distribution for that, and what are all the general question means. So what are all the things I have to add? Shall I have to add a note on embryology? Shall I have to draw a histology diagram, whether the time permits? These things you should have an overall view, and finally you should check also for the total 180 minutes. For 20 minutes, it's not in your hand, because MCQs, they will take away that paper in 20 minutes. Then see another one. So when it's in a single page also you can plan. So how you can plan is first prioritization is draw the diagram is the first priority. And if they are asked the question of cutaneous innervation of hand, and what is the nerve and what is the area of supply. Hand means both palm and dorsum, that you have to remember. And sometimes what you will do is you will be very choosy to write only about the palm. And some people, they think palm, there is nothing only on the dorsum. These are the mistakes you will do. And similarly, for the foot also, you can plan like this. So I'm not going to teach you in detail about these topics, but how it can be presented and prioritizing high scoring. These are 5 marks questions. Prioritize more for the 5 marks, then for the 3 marks, because 55 marks component is there for that. So there is a possibility of scoring. Even if you get 11 into 3, 33 marks, you will get it out of 55. Then rather than focusing more time on those 10 marks question, so however, whatever much you write, you will get maximum of 8 only. Don't get stuck there. Move forward for the high scoring ones. And this is the way when derivatives of second pharyngeal arch, not even derivative, second pharyngeal arch, that was the question, this was the answer. And see this one, it's not a structured one. And what they expect. So how to introduce it, what are the components in that each pharyngeal arch, and what arches disappear, what will persist, what do you call the second arch, what is the cartilage of the arch, with a one diagram, simple diagram, which is easy for you to practice. And then the derivatives from various components. So what are the skeletal derivatives and what are the muscular derivatives? And you know that all these derivatives start with S. This is also one tip for you. And what are those that start with S? Don't write whatever yes, you know. Okay. So what are the relevant ones you have to write in that area? And when you are preparing itself, you have to focus on that. And what are all the muscles that will be coming from it? And another note, all they are migratory. All are migratory except stapedius and stylohyoid. And what is their nerve supply? And artery also, all inclusive table you can practice and keep it ready in your mind, and it can come out easily when you are writing that question. And then there is the how to manage the anxiety itself. Okay, so build self-confidence is the one that is required, and always tell yourself, I have prepared well and I will do well and can handle any type of question. Okay, then take some deep breathing, keep your mind, that will keeps your mind steady. So in between you have to do it, and take a sip of water also, and you have to always sit straight and have a smile, okay, not laugh, okay. So it will influence the confidence in you, because you are the person, you have to help yourself there, okay. So whatever help the teacher can do or parent can do, they will do it, and there you are facing it, okay. So then another question is, if they ask, enumerate the coverings and constituents of spermatic cord. See, enumerate, it is not asking what is spinal spermatic cord and what is its length, all those things they did not ask. So straightforward. So what are all the coverings and constituents? So what are the coverings you have to mention? And another thing which you can see in this one is, you are seeing something here which I will highlight. See the list of trees. What are all the trees? That numerology is also important sometimes. Okay, in remembering. And what are all the three arteries, 3 veins, 3 nerves, and what are the 3 others? With a simple diagram, the 3 marks, within 5 minutes you can complete it. This is the one such thing. And sometimes you will get a question, clinical one. Explain the anatomical basis for meralgia paresthetica, and you have to define what is that meralgia paresthetica and where they will feel that unpleasant sensation and what aspect of the thigh and what is there in that aspect for this one. Lateral cutaneous nerve of thigh and where it is getting compressed. Yeah, and how does it exit from there, and what is the relation with the inguinal ligament? This you should have, and you need not draw the plexus, but remember what is it, and what are the points here? You have to concise. So what is the origin, course, relations? If you follow a flow chart like the one which I am showing here, that will be helpful to you and that saves you time. Where you have to use the flow chart and where you have to use the table, where you have to use some memory mind mappings also. You should know that we will discuss tomorrow also. And how see the course of it. Now, if you I don't know whether you are taking a picture of it and how to follow that course. Also, you have to see and with a simple diagram, whatever you can draw. Okay. So, but the flow chart should indicate. So, the examiner who is valuing the paper, by looking at this, you know, you have understood very well and your presentation is excellent and you have completely covered all aspects of it. That is the impression they will get it. Then there is this is a theory, practical or viva. You will be asking upper end of humerus. Then you can have a flow chart like this. You can prepare it and then while reading itself, focus on this one along with the specimen and then mark it. Okay, so you should be able to identify. I hope you have identified this one. I hope you have identified this one. I hope you have identified this group. And then what are all the things? What is sit and what is situs and what is ready between two majors? All this should come to your mind. Then you will know what is the head, what are the necks, how many necks are there, which neck is important, and what nerves are related to it, and what is the importance of morphological neck. These things you have to focus. And if there is, I said, the mnemonic sit for greater tubercle and lesser tubercle is another S is there. So both put together sits. And what are these sits muscles? They are the rotator cuff muscles you should remember. And what is intertubercular sulcus? It's ribs and ready between two majors. What does it mean also? You have to do it. And similarly, related to it, what are the nerves related to humerus? We will be asking. And you should be able to tell and what are the nerves that are nerves and vessels also. You can see here, I have put it. So, three important nerves related posteriorly, what are they? And mid-shaft, what nerves? And supracondylar fracture. What do you mean by supracondylar fracture? What nerve and vessels are there? So like this, you plan a table like this, and what will happen if there is a damage to this nerve? So, and what is the cause for the damage and what is the site of fracture? This will help you for a clinical orientation. And once you start practicing like this, it will help you in your clinical courses also. You will carry the same type of pattern there and you are going to be a successful doctor. Okay, so there is a question. Write short notes on femoral nerve. So already one of the friends, they have taken a class on this one. That is the femoral nerve. This memory picture is there, what she has explained. And then based on that, you have to reconstruct that picture. So I have a flowchart diagram like this. This is also memory mapping, you call it. You can call it also. And what are the various zones along which it is going and what's the course and termination. You can have start planning a table like course and termination and what are the branches and what is the effect of injury to the femoral nerve because of the stab or gunshot wound of thigh, what is the motor loss, what muscle is paralyzed, and why the inability to extend knee and legs are there, what is the sensory loss along what aspects of the thigh, and what aspect of leg, what border of foot, and what is the extent of it, whether it will go to the tip of or ball of grade 2. These things you will get a answer for that. Then. Now, the philosophy of life is what you get out of life depends on what you put into it. And same with, that was whatever you put for the menu, music, machine, medicine, mind, magic, examination, and how you played it. So I have modified the quote of Tom Lehar. So how well you prepare for an event and how well you organized for success will decide the outcome. And I hope this is going to be my final slide. And if time permits only, I will go for other slides. And now I pass it on to Deepa. Deepa? Yes?
Yes, ma'am.
Yes, I have completed this one, and if they want some more, I have spare slides, but it will be too much of anatomy for them. They should not get bored. And
So, ma'am, they have to do the masterclass first session, the questions, the assignment.
yes,
So,
let them do it.
students, I'm sharing the assignment link in the chat room. I request you all to please fill in and submit. I will be sharing your responses with ma'am, and if you still have any questions, for example, after the giving out this assignment, you still have some doubts, we would be having another session tomorrow. Ma'am would be happy to take your queries,
Yes.
but please do remember we have other session tomorrow to complete, as well as we can discuss your forms. So form link has been shared in the chat room. This is a form. This is an assignment basically for you, where the first three questions is about your individual personalities, like for example your name, email ID, and your college name, and the rest 10 questions is for your the session ma'am just have taken. Ma'am has prepared this questionnaire for you so that you should have an understanding about it. It's there in the chat room. If anybody is having any problem in accessing it, do let me know.
They have put some questions. Now I could see the questions.
So Vakiti Pragati Kumari has said that she could not attend his yesterday's session, but there was no other session happened. This was the first session. There would be the next session tomorrow, and we would be concluding it with the third session on Wednesday. So these are the three sessions. There's one more question for you, ma'am, Dr. Velichetti.
Yes.
Is there any basic framework for an answer?
Yes. The basic framework depends on the question. That's why you have to focus on the what is asked. And if it is a general question, stomach, if they give. So what is, where is its location? What are the ends? What are the margins? What are the surfaces? And then what are the peritoneal folds? So depending on the topic, you have to formulate a basic framework. And for a histology diagram, you have seen what you have to do. And for a bone, how to do it. So like that, depending on the question, we are teaching also, we will tell you, these are all the components. And now in the NMC curriculum, it is there also. So those are the ones which we have shown in this one. And if you see in the book also, Thaima book also, so on what are all the components we have to include, that will be there. So it's a basic framework is first look for a diagram, relevant diagrams sometimes. So you have to focus on the diagram, and with the diagram, what is your explanation? Yeah, and they don't expect you to write sentences. So write points. You have seen, I have never written lengthy sentences. It's all points. Focus on putting the points. That is always the best way. And for that, you have to understand it and then put the points. Then wherever explanation, explain if they ask, then you have to explain. Okay, otherwise, most of the times what we expect from you as an undergraduate is points with bullets. That's why I always have the bullets. Okay, you are in the bullet age, and what we expect you also to put bullets in your answers. That is the thing. Hope it is clarified, or anything also I can explain.
There are a few more questions, ma'am. I'm just unrecord the session now, and we will take the queries because it would be otherwise end the video. So I'm stopping the recording for this.